Did you know that over 900 medications, toxins, and herbs have been linked to liver injury, with drugs accounting for 20 to 40% of all cases of fulminant hepatic failure? According to research published by the National Library of Medicine, more than 2,000 cases of acute liver failure occur annually in the U.S., and half of these cases are connected to the use of medications or supplements. Drug-induced liver injury occurs when medications or other substances harm the liver. This condition can range from mild increases in liver enzymes to severe liver failure or even death. Drug-induced liver injury is particularly concerning because the liver plays a vital role in metabolizing drugs, and any damage can compromise its function, leading to serious health issues. In this video, we'll discuss 7 widely used medications that are most commonly associated with liver damage. Spoiler alert, you likely have the last one in your home. We'll also explore how long it takes for medications to harm the liver and cover 10 warning signs of drug-induced liver injury. When it comes to liver health, catching problems early is key to preventing liver failure. So, make sure to watch until the end. Before we dive in, do me a favor, hit that like button and subscribe to our channel. By doing so, you're not just supporting us, you're helping raise awareness that could save lives. Let's get started. 1. Statins. Statins are a class of medications widely used to lower cholesterol levels in the blood. They work by inhibiting the enzyme reductase, which is crucial for cholesterol production in the liver. These drugs are prescribed to reduce the risk of cardiovascular diseases, such as heart attacks and strokes, particularly in individuals with high cholesterol, diabetes, or a history of heart disease. Although generally safe, statins can occasionally cause liver injury. Because they are metabolized in the liver, their use can sometimes lead to stress on liver cells. This stress may result in elevated liver enzyme levels, an indicator of liver inflammation or damage. While these enzyme elevations are often mild, asymptomatic, and reversible when the medication is stopped or the dosage is adjusted, in rare cases, they can progress to more severe liver injury. The risk is particularly pronounced in individuals with pre-existing liver conditions or those on high doses of statins. Research has highlighted this connection between statins and liver injury. For example, the American College of Cardiology reports that 1 to 3% of statin users experience mild elevations in liver enzymes, typically within the first few months of treatment. To minimize the risks of statins to the liver, it is essential for patients to follow a few key precautions. First, always use statins as prescribed and never exceed the recommended dosage. Regular monitoring of liver function through blood tests, especially during the first months of treatment or after dose adjustments, can help catch potential issues early. Maintaining a healthy diet and limiting alcohol consumption can further reduce the strain on the liver. Lastly, if you experience symptoms such as fatigue, jaundice, or abdominal pain, report them to your healthcare provider immediately, as these could be warning signs of liver injury. 2. Methotrexate. Methotrexate is a widely used medication prescribed for various conditions, including autoimmune diseases such as rheumatoid arthritis, psoriasis, and Crohn's disease, as well as certain cancers like leukemia and lymphoma. It works by interfering with folate metabolism, a vitamin essential for DNA synthesis and cell division. In autoimmune diseases, methotrexate suppresses the immune system to reduce inflammation, while in cancer treatment, it slows or stops the growth of rapidly dividing cells. Despite its effectiveness, methotrexate can sometimes cause liver injury. Since it is metabolized in the liver, long-term use, particularly at higher doses, can lead to liver toxicity. This may manifest as mild elevations in liver enzyme levels or progress to more severe conditions, such as fibrosis, scarring of the liver, or, in rare cases, cirrhosis. The liver injury caused by methotrexate is thought to result from the accumulation of toxic metabolites in liver cells, which can lead to oxidative stress, inflammation, and subsequent damage. Several factors can increase the risk of liver injury from methotrexate, including pre-existing liver disease, obesity, excessive alcohol consumption, and prolonged use of the medication. Research has highlighted the potential for methotrexate to harm the liver. A study published in the Annals of Rheumatic Diseases found that patients with rheumatoid arthritis who used methotrexate over an extended period were at a higher risk of developing liver fibrosis, particularly when other risk factors were present. 3. Ketoconazole, oral. Ketoconazole is an oral antifungal medication used to treat severe fungal infections, particularly those that affect the skin, lungs, or other internal organs. It works by interfering with the synthesis of ergosterol, an essential component of fungal cell membranes. By disrupting this process, ketoconazole effectively inhibits the growth and spread of fungi. Although it was once a widely used antifungal treatment, oral ketoconazole is now reserved for serious infections when alternative treatments are unavailable due to its potential side effects. One of the most concerning side effects of oral ketoconazole is its potential to cause liver injury. As the drug is metabolized in the liver, it can place significant stress on liver cells, leading to conditions ranging from mild elevations in liver enzymes to severe liver damage, including acute liver failure. The exact mechanism of ketoconazole-induced liver injury is not fully understood, but research suggests that it may involve oxidative stress and immune-mediated damage. Risk factors for liver injury with ketoconazole include pre-existing liver disease, prolonged use, and the use of high doses. Several studies and reports have documented the risk of liver injury associated with oral ketoconazole. According to the U.S. Food and Drug Administration, FDA, cases of severe hepatotoxicity, including fatalities and the need for liver transplants, have been reported in patients taking this medication. Doesn't seem to be worth the risk, especially if you are using it for only skin treatment, wouldn't you say? 4. Diclofenac. Of course, you know that diclofenac is among the medications most commonly linked to liver issues, despite its widespread use for managing pain and inflammation. Diclofenac is a nonsteroidal anti-inflammatory drug frequently prescribed for conditions such as arthritis, muscle pain, and migraines. It works by inhibiting enzymes called cyclooxygenases, which play a key role in producing substances that cause inflammation, pain, and fever. While highly effective in providing pain relief, diclofenac is known to carry a risk of liver injury, especially with prolonged use or at high doses. Because diclofenac is metabolized in the liver, its breakdown products can sometimes trigger oxidative stress and inflammation, leading to liver damage. In most cases, liver-related issues with diclofenac are mild and reversible, such as slight elevations in liver enzymes. However, in rare instances, it can cause severe hepatotoxicity, including acute liver failure, which can be life-threatening. To manage pain naturally, consider incorporating anti-inflammatory foods like turmeric, ginger, and omega-3 rich fatty fish into your diet, alongside regular gentle exercises such as yoga or swimming to improve circulation and reduce stiffness. Additionally, natural remedies like applying warm or cold compresses, using essential oils like peppermint or eucalyptus, and practicing relaxation techniques like meditation can effectively alleviate pain without harmful side effects. But we are not anti-medications, and consult your doctor before going for the natural approach. 5. Nitrofurantoin. Nitrofurantoin, a commonly prescribed antibiotic for urinary tract infections, UTIs, is well known for its effectiveness against a wide range of bacteria. It works by disrupting the bacterial DNA, preventing their growth and survival. Despite its popularity and generally good safety profile, nitrofurantoin has been linked to potential liver issues, making it one of the medications to watch for in terms of hepatotoxicity. The exact mechanism of how nitrofurantoin causes liver injury is not fully understood, but it is believed to involve an immune-mediated reaction or oxidative stress caused by the drug's metabolites. Patients who use nitrofurantoin long-term or have underlying liver issues are at a higher risk of developing liver problems. Several studies have highlighted the link between nitrofurantoin and liver damage. Research published in the Journal of Hepatology documented cases of both acute and chronic liver injury associated with prolonged use of nitrofurantoin. To minimize the risk of liver injury, nitrofurantoin should be used only as prescribed and for the recommended duration. Long-term use, unless absolutely necessary, should be avoided. Patients with a history of liver disease, or those who experience symptoms such as jaundice, abdominal pain, or fatigue while taking nitrofurantoin should inform their doctor immediately. Regular monitoring of liver function is advisable for patients on extended courses of the medication. 6. Isoniazid. Isoniazid is a powerful antibiotic primarily used to treat and prevent tuberculosis. It works by inhibiting the growth of the bacteria that cause TB by interfering with the synthesis of mycolic acid, a crucial component of the bacterial cell wall. While isoniazid is highly effective in the fight against TB, it is also one of the medications most commonly associated with liver injury, which can range from mild liver enzyme abnormalities to more severe conditions like hepatitis or liver failure. Isoniazid-induced liver injury is a well-known side effect, particularly in individuals who are treated with the drug for extended periods. The liver damage can occur in two distinct patterns: a dose-dependent hepatotoxicity that generally happens soon after starting the medication, and an idiosyncratic reaction that is less predictable and can occur even after long-term use. The exact mechanism behind isoniazid-induced liver injury is not fully understood, but it is believed to involve the drug's metabolism in the liver, where it is converted into toxic metabolites that cause oxidative stress and damage to liver cells. Certain factors, such as pre-existing liver conditions, age, alcohol consumption, and genetic variations, may increase the risk of liver damage when taking isoniazid. 7. Allopurinol. Allopurinol is a medication commonly used to treat gout and certain types of kidney stones by reducing uric acid production in the body. This helps prevent the formation of uric acid crystals in the joints, which cause gout, and in the kidneys, which lead to kidney stones. According to the National Library of Medicine, although rare, allopurinol is a known potential cause of acute liver damage, often linked to hypersensitivity reactions, and in severe cases, it can lead to fatal outcomes. For this reason, patients starting allopurinol should be closely monitored to detect early signs of liver damage. Regular medical checkups are crucial for identifying any complications and adjusting treatment if necessary. It's essential for patients to report any unusual symptoms promptly while on allopurinol. Despite these risks, it remains an effective treatment option for managing gout and elevated uric acid levels in many individuals. 8. Acetaminophen, Tylenol. Acetaminophen, Tylenol, and paracetamol, Panadol, are essentially the same medication. A 2006 review study published in the BMJ Journal revealed that unintentional overdose of paracetamol is the leading cause of acute liver failure in the UK, and it is also the primary cause of acute liver failure in the United States. Due to its widespread use, some people misuse this medication, often taking higher doses than recommended, such as taking 3 pills at once for a headache, which can be dangerous. It's important to emphasize that adhering to the recommended dosage of paracetamol is generally safe. Overdosing on paracetamol can cause severe liver damage or even liver failure. Risk factors like alcohol consumption, genetics, and other medications can increase the likelihood of liver harm. Symptoms typically begin 1 to 3 days after an overdose, with more pronounced signs appearing within 2 to 4 days. Fortunately, acetylcysteine, fluimucil, is an effective treatment for paracetamol overdose and can protect the liver. However, if you suspect you've taken too much paracetamol, it's crucial to visit the emergency room and inform the doctor immediately rather than waiting, as early intervention is key to preventing severe liver damage that could require a transplant. Drug-induced liver injury can develop at different rates depending on several factors, such as the type of medication, dosage, individual susceptibility, and the person's underlying liver health. In general, drug-induced liver injury can present anywhere from a few days to several weeks after starting a medication, though in some cases, it may take months or even years to appear. Certain drugs may cause acute liver injury that manifests within days to weeks, while others could lead to chronic liver damage over a longer period. It's important to watch for signs of drug-induced liver injury, including jaundice, where the skin and eyes turn yellow due to elevated bilirubin levels. Nausea and vomiting, especially when persistent and accompanied by medication use, may indicate liver trouble. Abdominal pain, particularly on the upper right side where the liver is located, could be another warning sign, along with dark urine or pale stools, which can point to liver issues. Fatigue, weakness, and unexplained itching could also be linked to liver dysfunction, as could swelling in the abdomen, legs, or ankles due to fluid retention. Unexplained weight loss or sudden skin changes, like rashes or hives, might signal liver problems, and a fever combined with any of these symptoms warrants a visit to the doctor. Keep in mind that these symptoms can vary depending on the severity of the liver injury and the individual. If you experience any of these signs, especially while taking medication, it's crucial to consult a doctor as soon as possible. Also, Remember that even medications not listed here can still affect liver health. Many common drugs, such as certain HIV medications, niacin supplements, antibiotics, and even some herbal teas, can have adverse effects on the liver. If you find value in this video, please give it a like and subscribe to the channel for more helpful videos like this.